Hello, everyone. My name is Justin.
My name is Malissa,
And I'm Lauryn.
and this is our movement assessment project.
I was also the participant. I'm a 22-year-old female. In around 2014 and 2018, I had two right wrist sprains. For rehab, I did the RICE method, which is rest, ice, compress, and elevate, and splinted for the first couple of days. Between 2014 and 2019, I had three right and one left ankle sprains. For rehab, I again did the RICE method and wore a brace for the first couple of days. In 2018, during swim season, I had right upper trap pain. For rehab, I took painkillers and kept swimming. However, today my shoulder still clicks when I rotate my arm past my ear. Around 2014, during basketball practice, I had right knee meniscus pain. My primary care physician said it was a possible partial meniscus tear but never got scans to confirm. I sat out of sports for a couple weeks and wore a brace for anything more than walking, but stopped wearing it completely in 2020. For movement history, I grew up in a very play outside family. We went on a lot of family walks, and I had a constant rotation of sports. I played basketball between 2007 and 2019. In elementary and middle school, I played about 6 to 8 hours a week, and in high school, 10 to 12 hours a week. And I also swam competitively between 2016 and 2020. For current movement, for physical activity, I swim leisurely. However, I stopped working out about 2 months ago. Activities of daily living, I do basic chores and drive about 6 to 8 hours a week. Sleeping, I'm a stomach sleeper, and I sleep with my arms under my head or pinned underneath my chest. I also do 5.5 hours of class a week and 16.5 hours lifeguarding.
Looking at the functional movement screening, the first test we will analyze is the deep squat movement. Some compensations we want to note here are in the sagittal view, the dowel isn't aligned over the feet and it goes forward. Secondly, the upper torso isn't aligned with her tibia since her torso goes forward as well. And we see that her femur isn't below horizontal but roughly around the 90-degree angle. Thirdly, we also see that she starts with a slight lumbar extension as she goes down and she finishes with a slight lumbar flexion. And lastly, we're looking at the frontal view. We notice two primary compensations, which are for one, dowel shifts laterally to the left, and secondly, we see a slight knee valgus. Since the squat wasn't completed without compensations, which wouldn't give her a perfect score of 3, we attempted to achieve a score of 2 with a composition of elevated heels on the FMS board, in which we noticed a slight lateral tilt to the right in the frontal view. But she was able to complete the squat movement, therefore she completed with a score of 2.
Regarding the hurdle step, we can see that for both legs we noticed ankle inversion, spinal extension, trunk rotation, and also a hip hike. We noticed on the left side that there was a decrease in the hip hike as her repetitions were performed, and we also did note that there was slight abduction of the moving leg while performing the movement for both hurdle steps. And her tibial tuberosity measurement was 40 centimeters from the floor.
For the inline lunge, the distance from the toe of the back leg and heel of the front leg was 40 centimeters. Now looking at the right, there's a noticeable forward lean and hip flexion, but the dowel maintains 3 points of contact. We gave a score of 2 due to failing to maintain a parallel posture with the tibia. Now for the left, again seeing the forward lean and hip flexion, we also see a slight trunk rotation, and again gave a score of 2.
Now for the shoulder mobility test, the hand measurement for Lauryn was exactly at 17 centimeters, in which we see that both left and right sides were within the one hand length. Therefore, this would give her a perfect score of 3. Now the first clearance test that would be assessed on Lauryn would be the shoulder impingement assessment, in which Lauryn felt no pain on both sides. Therefore, this would give her a passing score.
Now for the active straight leg raise, we can see that for both right and left sides, the ankle clears the dowel with ease. However, we did notice for both legs that there was external rotation of the non-moving leg, and we can see that with the foot.
For trunk stability push-up, we first attempted for a score of 3, but the participant was unable to perform the movement without compensations. To attempt for a score of 2, the participant again failed to perform the movement without compensations, therefore resulting in a score of a 1. For both attempts, the participant favored their right arm and initiated movement their first as well as excessive plantar flexion and moving in segments and not as a single unit. For the spinal extension and flexion clearing test, the participant felt no pain in both and therefore passed.
Now for the rotary stability, specifically on the right side, as we can see here on the left one, this one is going to be attempting the score of a perfect 3. In this case here, Lauryn was unable to perform the movement, so therefore we will go ahead and regress to the contralateral movement for the attempt to achieve a score of a 2. As we see here on the right side, she was successful in maintaining that complete motion, so therefore we would give her a score of 2. And the only slight compensation movement that we see here for Lauryn is a slight lumbar flexion and extension throughout her movement.
Regarding the rotary stability for the left side, we gave her a chance to attempt for a score of 3. However, she was unable to perform the movement, so we regressed to diagonal movement for an attempt to achieve a score of 2. Looking at the videos on the right hand side, we do see that she was successful in achieving a score of 2 for that as well. We also noticed that, similar to the right side, it was also present in the left side for rotary stability, that she had slight flexion and extension in her lumbar spine. Overall, she resulted in a final score for a movement of 2.
We had 4 main areas of concern, the first being rotary stability. So we plan to do a chop and lift exercise because of the lack of core stability highlighted in the FMS. Second, since our participant does a lot of sitting every day, we are activating glutes through glute and hip bridges with a resistance band. Third, the deep squat with compensation expose a limited ankle dorsiflexion mobility and can be due to the multiple ankle sprains. We decided to do unsupported heel mini squats to break up any scar tissue. Finally, for core balancing, we are doing the plowing the field exercise to improve the trunk stability and core issues found throughout the FMS.
Now looking at the training program for the corrective exercises according to Lauryn, in this case here we see that she will be training 2 times per week for a total duration of 4 weeks. As we see here, her specific days will be Tuesday and Thursday throughout the week. As we see here throughout the chart, we see that her warm-ups will be consisted of not only Stairmaster for 5 minutes, World's Greatest Stretch, arm swings and circles, walking hamstring scoops, and lastly walking lunges. And then that's when we will go ahead and transition to the actual exercises that would put an emphasis on her main areas of concerns, which would be a total of 3 sets of 10 repetitions for all of those.
Regarding the training program and our plans for progression for each of the corrective exercises, for the push-up shoulder touch, she will be starting with her hands narrow to increase her base of support, and then for progressing that movement, we will have her widen her hands to shoulder width from the narrow position, so that way it can increase the difficulty of the exercise. For the chop and lift on the cable machine, we will have her either increase the weight or move from 2 knees on the ground to only having 1 knee on the ground. For the glute and hip bridges with the resistance band around her thighs above her knee, we will have her go into the standing, from lying on the ground to standing with internal and external rotation with the band, and then hopefully progress to the single leg stance with the free moving leg going forward and backward in a C motion. Lastly, for the plowing the field exercise, we will have her progress into having both legs raised and drop one leg while holding the resisted bar into her hips.